All right, welcome back to Eyewitness News at Noon. Dr. Mark Simpson with Simpson Dental Associates joins us now for our Ask the Doctor segment. If you've got a question for Dr. Simpson, the number to call right there will be popping up on your screen. There it is. Let's talk about some technology that your office has that's a little unique. Not a lot of places have this.
Well, and you're going to see it more and more. It's a dental microscope, and they may be having a picture of one here. But basically what this microscope does is allow you to see things in very great detail. You might see dentists wear loupes or something on their eye to help with magnification. But this is like the extreme of that, and it's particularly practices that do a lot of cosmetic work and ones that do endodontics or root canals. Generally, you'll see those. So it's not something to be surprised to see when you go to your dentist. It doesn't mean he's losing his vision. It just means that he needs to see it, or she needs to see it more accurately in more detail. A lot of times when we're looking for cracked teeth, we'll use the microscope to help us determine if a tooth is cracked. Now, generally, when you have a cracked tooth, the symptom that you would have would be as you bit on the tooth, you get kind of a sharp pain.
Right.
If it's a dull pain or an ache, generally that is not consistent with a cracked tooth. But a lot of times you take an x-ray of a cracked tooth and you don't see anything, because what I tell people is that it's not like a broken bone where there's a space between the bone. With a tooth, the tooth is held together, and only as you bite does it pry it apart, and that's when you can get kind of a sharp little electric pain. So a lot of times this happens in people that have a tooth that has an old filling in it that's leaking, and they don't get it taken care of in time, and then the tooth will crack.
Okay, Dr. Simpson, let's go to the phones. We've got a call from Carol. Carol, what's your question for the doctor?
Yes, doctor.
Yes, Carol.
Listen, I'm from old school. I'm 69 years old. Good teeth run in my family, but I take care of everybody else's teeth but my own. And long story short, I don't get them cleaned often enough. But I've got 5 teeth left on my top, and I have just about all of them on my bottom. But
I see.
And I have an excellent dentist. But I'm going to have my top teeth. I have a bridge. One of my crown. I have 2 front teeth. One of my front teeth is so loose I can pull it out. The other one, the crown or whatever it is you put over it, the whatever.
Right, a crown, probably.
Yeah, and then on a side, does the whole thing come out off the, it's just like a little point sticking down.
So what's your plan for your teeth then? What do you want to do?
Okay, what I want, is there any kind of new invention where you can get a plate that will fit in your mouth that can be held by something other than glue or powder or something like that?
Absolutely. And the answer to that is dental implants. And there's basically 2 ways to do that. There's the delayed method where you may take out your teeth and get the implants placed and not connect the denture to it immediately. But the way we prefer to do it is to take the teeth out, place usually 6 implants in the upper jaw, and connect the denture to it that same day. So it's all done in one day. And the big advantage is, number 1, you're eating with it at night. Number 2, you didn't have a period of time where you just had a denture flopping around in your mouth. And number 3, it's much more stable. So that's talk to your dentist about that. And if I can answer any questions, they always put my number at the end, and I'll be happy to talk to you and explain that to you. But that's the latest, greatest technology, and it works fantastic.
Okay, we have another caller. Another Carol is on the line.
Another
with us.
Carol.
Another Carol
Carol
this afternoon. Carol, what's your question?
Question is, I'm losing the gums on my bottom.
Right.
And I would like to know if you do that kind of surgery. If so, if you do a bone graft, or what kind of graft, or...
Well, first of all, it sounds like you have periodontal disease, and that's what usually causes the bone to deteriorate around teeth. So the very first thing to do is do bacterial testing to figure out which bacteria you're dealing with, because it's very possible that if you find the bacteria and treat it properly, and usually that involves antibiotics, but you have to know which bacteria it is to know what antibiotic to give. And a lot of times you can treat the disease and effectively stop it so that it doesn't cause you to lose your teeth. Periodontal disease is a slowly progressive chronic disease that destroys the bone and then weakens the teeth so that the teeth will fall out. So first thing to do is realize that you've got to treat the disease to save your teeth.
I have already had my teeth taken out.
Okay.
And they are worn completely down past the gum into almost past the root.
Well, you're a candidate then for dental implants if that's the case, because if your teeth are that worn down, there's not going to be enough tooth to attach anything to. Now, on occasion there will be, and there's other things called overdentures and things like that. But really the state of the art now is to use dental implants to replace teeth, and that is the standard of care, by the way. In other words, if you're faced with losing a tooth, your dentist is going to say a dental implant is the best way. And the reason for that is because it preserves the bone, and then it allows you to connect something to it which will be stable. Then you can chew your food properly.
All right, Dr. Simpson, thanks for coming in today.
Very good.
I think we got some good questions coming up
Thank you
next.
so much.
Stay tuned for a look at the